What is ampicillin? Indication, side effects and contraindication. Interesting about science and medicine, prepared by editors of a page all scientific. First of all, you should start with the fact that ampicillin is part of a penicillin group. This group includes 5 categories of antibiotics: penicillin-sensitive penicillins, antipseudomonal penicillins, beta-lactamase inhibitors, natural penicillins, aminopenicillins. Classification of penicillins. Penicillins are classified into narrow spectrum beta-lactamase sensitive first generation, beta-lactamase resistant second generation, and broad spectrum aminopenicillins third generation antibiotics, carbopenicillins fourth generation, uridopenicillins fourth generation. The main representatives of aminopenicillins are amoxicillin, ampicillin, pivampicillin, hetacillin, bacampicillin, metampicillin, talampicillin, epicillin. What is ampicillin? Ampicillin is a chemical substance with a molar mass of 349 grams per mole for ampicillin trihydrate and 371 grams per mole for ampicillin sodium salt. Melting point 208 degrees, solubility in water 10 grams per liter, white and crystalline powder. How many names does ampicillin have? Ampicillin has more than 100 names branded and scientific. Ampicillin, aminobenzylpenicillin, ampicillin acid, amchil, polychillin, principen, toxyocillin, ampicillin anhydrous, ampicillin, somicillin, pembritin, diampicillin, adobacillin, amblosin, ampichel, ampicillin, ampifarm, ampipenil, ampiscel, amplacin, amplipenil, amplisom, amplital, bonapicillin, britacil, compicillin, cofaricillin, delcillin, devircillin, doctacillin, dofacillin, grampenil, guicitrină, lifampil, norobritin, orbicillin, pembristol, pembroc, penicillin, pentrexil, perincillin, racenalin, ronzamplin, servicillin, sumipanto, texicillin, totalcillin, trifalicin, ultrabron, vicillin, acilin, ampipen, ampicil, ampichel, ampimet, ampisin, ampivax, ampipvet, amplin, binotal, morepen, nuvapen, penimic, pensin, pentrex, ponecil, tolomol, totapen, vampen, cimex, supen, ampicillin anhidrat, totalicin, pizarpen, A, amepenix S, ampibol, sicampicillin, penampil, chiaidemp, ampitab, dicillin, olinchid, roampen, ampico, ostrapen, pen A, ampicillina, Bayer 5427, ampicillina, ampicillin, ampicillinu, ampicin, D-alpha-aminopenicillin, deripen, vapicil, alpen, AI6108, Omnipen N, Beryl 1341, Semicillin R, BRL 1341, Redicillin, Guitricin, and others. Chemical composition of ampicillin, sodium salt. The chemical elemental composition of ampicillin is as follows: carbon 52%, oxygen 70%, nitrogen 11%, sulfur 8.6%, sodium 6.2%, hydrogen 4.9%. Identifiers registration code for ampicillin are as follows: CAS number 69534, PubChem CID 6249, Drug Bank DB00415, ChemSpider 6013, UNII 7 C78296 RD. When was ampicillin discovered? History of these antibiotics. Ampicillin was discovered in 1958 in Great Britain, when it began to be sold in pharmacy in 1961. The use of ampicillin and cotrimoxazole as an alternative to chloramphenicol in the treatment of typhoid fever began in 1970. The price of ampicillin depending on quality. Ampicillin is sold in various forms in pharmacy as a medicine. Its cost is very small, for example, one cost unit. But for laboratory research for analytic purposes, the same medicine is sold that is also ampicillin only 15,000 times more expensive. It all depends on the quality and purity of the product. In what form is ampicillin produced? Ampicillin is available in the form of ampicillin trihydrate for oral administration through the mouth and ampicillin sodium salt for parenteral introduction. Solubility of ampicillin in water. White crystalline powder or granule of bitter taste, ampicillin trihydrate is non-hygroscopic, slightly soluble in water up to 2%. Ampicillin sodium salt is easy soluble in water up to 0.5 grams in 1 milliliter. Pharmacological properties of ampicillin solution are quickly inactivated. Ampicillin does not cause noticeable irritation to tissue, does not accumulate and has very little toxicity, so it can be used in large doses. The scintillating effect is expressed to a moderate degree. Resistance of ampicillin to various factors. The drug is relative acid resistant but is destroyed by penicillinase of penicillin-resistant bacteria. It binds little to protein, therefore, when it enters the blood, its effect is not reduced. The introduction of ampicillin to the body. Ampicillin, when taken orally, is absorbed rather quickly in the intestines when enter the internal organs, tissue and body fluids, creating concentration sufficient for therapeutic action. Partially, the drug is destroyed in the stomach and intestines, although the main amount is absorbed. How long does it take for ampicillin to reach therapeutic blood levels? The maximum blood concentration of ampicillin trihydrate are observed 1-2 hours after ingestion, remaining at therapeutic concentration up to 6 hours. The content of ampicillin in the blood is usually proportional to the dose taken and is partly maintained by repeated absorption of the antibiotic secreted into the intestine with bile. How quickly is the therapeutic concentration of ampicillin in the blood achieved? When taken orally, its concentration in the blood is slightly lower than when administered parenterally. Since it is completely absorbed in the intestine only 6 hours after ingestion, but with parenteral administration, it is excreted from the body somewhat faster. With intramuscular administration of ampicillin, its content in the blood is much higher. The maximum concentration are observed already after 30-60 minutes and with intravenous after 15-20 minutes, but is excreted from the body faster, which require more frequently intravenous administration of the drug. Distribution of ampicillin in the body. Ampicillin form therapeutic concentration in the pleural, peritoneal, and synovial fluids. In the sputum, it is found in much lower concentration than in the blood due to its partial decomposition by enzymes. In the lung, lower concentrations are also found than in the blood, and in the inflamed area, the content of ampicillin is higher than in the unaffected ones. Distribution of ampicillin in various organs. Concentration in bone tissue are 50% lower than in blood. It also determined in prostate gland. Particularly, high concentrations are observed in the kidneys and liver. What concentration of ampicillin are observed in children? In the blood of newborns and infants, its higher concentrations are observed than in children of older age groups. Excretion of ampicillin from the body. Ampicillin is excreted from the body mainly by the kidneys. For the first 6 hours after ingestion, up to 30% is excreted in the urine, and after intramuscular administration, up to 60-70% is excreted in 12 hours. Concentration in urine is very high, from 150 to 3,000-6,000 micrograms per milliliter, which is many times higher than the content in the blood. Ampicillin is excreted only through the kidneys. Particularly, antibiotics is also excreted in the bile, especially in case of impaired renal function. In bile, concentrations are significantly higher than in blood, from 4 to 100 micrograms per milliliter. Antimicrobial activity of ampicillin. Ampicillin has a fairly wide spectrum of antimicrobial activity. Many gram-negative and gram-positive bacteria are sensitive to it. Actively affects strain of Staphylococcus sensitive to penicillin. Streptococcus and Pneumococcus, all are less sensitive to ampicillin than to benzylpenicillin. Microorganisms sensitive to ampicillin. Gonococcus, Meningococcus, Enterococcus, the latter is more sensitive than to benzylpenicillin. Listeria, gas gangrene, Clostridia, more than penicillin, various Escherichia, Salmonella, pathogen of typhoid fever, Shigella, some strain of Klebsiella, and Proteus, Haemophilus influenza. And of course, Staphylococcus and Streptococcus and Pneumococcus. Ampicillin-resistant microorganism. Staphylococcus resistant to penicillin is also resistant to ampicillin as a result of a destruction of antibiotic by penicillinase. Resistant to ampicillin, Pseudomonas aeruginosa, Mycobacterium tuberculosis, some strain of Klebsiella, many strain of Proteus, especially vulgar, Morgan, Redger, pathogen of tularemia. Ampicillin resistance develop rather slowly, even compared to benzopenicillin resistance. The use of ampicillin. Although the spectrum of action of ampicillin resemble tetracycline and chloramphenicol, it favorably differ from them mainly in the bactericidal mechanism of action and the absence of pronounced toxicity. How does ampicillin work? It acts only on multiplying bacteria but also kills bacteria that are inside the cells. Despite the rather wide spectrum of antimicrobial activity, ampicillin given the frequent case of pathogenic resistance to it. Despite the rather wide spectrum of antimicrobial activity, ampicillin, given the frequent cases of pathogen resistant to it, should be applied only with sufficient sensitivity of a pathogen in a laboratory study. How toxic is ampicillin? Due to its very low toxicity, it can be prescribed at dose significantly higher than usual and for a long time, up to several weeks, depending from infection, which is especially important in chronic pyelonephritis and septic endocarditis, in which it can be administered for months without fear of toxic complication. Is ampicillin prescribed for pregnant women and children? In pregnant women, newborn and infant, it can be successfully replaced by more toxic tetracyclines, chloramphenicol and streptomycin, but with staphylococcal disease, and with the sensitivity of a pathogen to benzylpenicillin, it's irrational to prescribe ampicillin. Take only after consulting a doctor. For what infection can ampicillin be used? Ampicillin is used for infection caused by sensitive mainly gram-negative bacteria in septic process infection in urinary organs, liver and biliary tract, lungs and bronchi, with various purulent inflammatory surgical and gynecological infection, peritonitis, osteomyelitis, intestinal infection, salmonellosis, dysentery, gas gangrene, gonorrhea. The use of ampicillin in the treatment of listeriosis and endocarditis. It is currently considered as the most effective remedy for listeriosis, and in combination with aminoglycoside antibiotics, kanamycin, especially gentamicin sulfate, is very effective in septic subacute endocarditis and various enterococcal infections. What pathogens of meningitis are treated with ampicillin? Effective in some form of meningitis, especially caused by meningococcus, enterococcus, listeria, various enterobacteria, Haemophilus influenzae. Ampicillin for typhoid fever. Many authors note its effectiveness in typhoid fever given the slight toxicity and the possibility of ingestion through the mouth, although it can be administered intramuscularly as well as in combination with chloramphenicol, which positively affect the reduction in the number of relapses and the overall effectiveness of treatment compared with appointment on chloramphenicol. Side effects of ampicillin. Main side effects of ampicillin. Side effects are basically the same as other penicillin drugs: rash, intestinal dysbacteriosis, headache rarely, arthralgia, depression, or conversely aggressiveness, and other complications. A rash as a reaction to ampicillin. Relatively often in 5–10% of patients, there is a kind of spotty nodular rash that begins on the throat and spreads rapidly on limbs and head. It can be accompanied by itching, sometimes fever that turns into eczema. These complications apparently do not have an allergic etiology, especially since allergic tests with penicillin or ampicillin usually give negative results. Such phenomena are most often observed after 5–10 days of treatment with ampicillin, especially in large doses. Intestinal dysbacteriosis while taking ampicillin. With prolonged ingestion, the development of intestinal dysbacteriosis is possible, therefore after several days of using ampicillin. It is desirable, and in the presence of intestinal disorders, it is mandatory to prescribe biological drugs such as bifidobacterium, bificol, or colibacterium after the end of the course of treatment. During the course of treatment with this antibiotic, from 4 to 8 days, levorin or nystatin in tablets under the tongue should be prescribed. Ampicillin contraindication. Contraindications are the same as for other penicillin preparation drugs, especially hypersensitivity to antibiotics of this group, as well as infection mononucleosis. It is irrational to prescribe ampicillin for staphylococcus infection. Caution is required in violation of liver function. Thank you for your attention. This material was prepared by editor of a page O Scientifical. Attention, this material is for information purposes only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.